If your hands and feet feel like they are being stabbed with countless tiny needles, I need you to pause whatever you are doing and listen very carefully. What I am about to share has helped a 67-year-old patient of mine regain feeling in her fingers in just 14 days using something you likely already have in your medicine cabinet. My name is Dr. June Romeo, and for more than 20 years I have treated hundreds of patients over the age of 60 who were struggling with nerve damage. What truly breaks my heart is how many people live every day with tingling, numbness, and burning pain in their hands and feet, without realizing that there may be a simple solution capable of changing everything in as little as 2 weeks. Today, I am going to explain exactly which B vitamin your nerves desperately need, why it works, how much to take, and the critical mistake most seniors make that prevents them from seeing real results. I encourage you to stay with me, because what you learn over the next several minutes could help you regain sensations in your hands and feet that you believed were gone forever. Before we go any further, I would genuinely love to know where you are watching from and how old you are. Please share your location and age in the comments. This information helps me create content that truly serves people like you. Now take a moment and ask yourself if any of these warning signs sound familiar. Do your hands or feet tingle when you lie down at night? Do you struggle to feel hot or cold water when washing your hands? Are small tasks like fastening buttons becoming frustrating or difficult? Do you ever feel unsteady or unsure of your footing when you walk? Or perhaps there is a persistent burning sensation in your extremities that never seems to fully go away. If you answered yes to even one of these questions, your nerves are sending out a clear distress signal. What most doctors fail to explain is that this is not merely an issue of discomfort. Untreated nerve damage can progress into permanent loss of sensation, a higher risk of dangerous falls, and a serious decline in overall quality of life. To understand why this happens, it helps to know what is occurring inside your body. Your nerves function like electrical wires that run throughout you, carrying messages from your brain to your fingers, toes, and every other part of your body. Each nerve is wrapped in a protective coating, much like the insulation around an electrical cord. This coating allows nerve signals to travel smoothly and accurately. As we age, particularly after the age of 60, our body becomes less capable of maintaining this protective layer. When it begins to thin or break down, the nerves underneath become exposed and damaged. They start misfiring, and that misfiring is what produces tingling, numbness, weakness, and pain. Here is where things become especially important. There is one specific B vitamin that your body absolutely requires to repair and maintain this protective nerve coating. Without it, nerves struggle to heal. With it, nerve damage can often be reversed or significantly improved. That vitamin is B1, also known as thiamine. Throughout my years in practice, I have seen people who could barely hold a coffee cup without dropping it, regain strength and control in their hands. I have watched patients who felt unsteady and fearful with every step become confident walkers again. I have seen individuals who believed their most active years were behind them return to gardening, cooking, and even dancing. The human body is remarkably resilient. Your nerves are designed to heal, but they need the correct fuel, and vitamin B1 provides that fuel. Think of it this way. If you owned a car and never added oil to the engine, the parts would eventually grind against each other, wear down, and fail. Vitamin B1 plays a similar role for your nervous system. It keeps everything running smoothly, protects nerve fibers, and ensures that messages travel from your brain to the rest of your body without interference. When B1 levels are too low, your nervous system begins to operate on empty. Signals become distorted, communication breaks down, and symptoms like pins and needles, numbness, and weakness appear. Walking can become frightening because you no longer trust where your feet are landing. When your body finally receives the B1 it needs, the healing process can begin surprisingly quickly. The protective coating starts to rebuild, nerve signals improve, and sensations gradually return. Many people assume they already get enough B vitamins from their diet, especially if they eat what they consider to be healthy foods. Unfortunately, this is often not the case for adults over 60. Research has shown that up to 1/3 of older adults are deficient in vitamin B1, and most have no idea it is happening. There are 3 major reasons for this. First, as we age, our stomach produces less acid. Lower stomach acid means poorer absorption of nutrients, including B1. Even if you are eating the right foods, your body may only absorb a fraction of the vitamin they contain. A younger adult might absorb 60 to 70% of dietary B1, while someone over 60 may absorb only 20 to 30% from the exact same meal. The second reason is medication use. Many commonly prescribed drugs actively reduce B1 levels in the body. Medications for diabetes, especially metformin, as well as diuretics often prescribed for blood pressure, can significantly deplete vitamin B1 over time. Certain medications used for heartburn can have a similar effect. These drugs may help manage one condition, but they quietly create another problem in the background. I have seen patients take these medications for 10 or 15 years without anyone ever checking their B1 levels. When nerve damage develops, it is often dismissed as a normal part of aging, when in reality it is a correctable vitamin deficiency. The third reason is related to diet and digestion. Even if you consume foods that are naturally rich in B1, such as whole grains, beans, and lean pork, your digestive system may no longer extract nutrients efficiently. On top of that, modern food processing removes much of the B1 from commonly eaten foods. White bread, white rice, and many packaged foods provide calories but very little nutritional value, including almost no vitamin B1. Let me share a real example. A patient of mine named Robert was 71 years old and very health conscious. He walked daily, ate vegetables regularly, and avoided junk food. By all appearances, he was doing everything right. Yet he came to see me because the numbness in his feet was worsening every week. He described it as feeling like he was walking on thick socks all the time. He struggled to feel the pedals while driving. When we reviewed his medications, it became clear he had been taking a diabetes medication and a diuretic for many years. Those medications had been silently draining his B1 reserves, and no one had ever warned him. We started him on vitamin B1 immediately. Within 3 weeks, he called me emotionally overwhelmed. He told me he could feel the ground beneath his feet again and could sense the pedals in his car. He said it felt as though someone had turned the lights back on inside his body. That moment reinforced just how many people are suffering unnecessarily because low B1 levels are overlooked. If you are over 60 and experiencing tingling, numbness, burning, or weakness, it is essential to address your B1 status as soon as possible. Every day that passes with a deficiency allows further nerve damage to occur. Early damage can often be reversed relatively quickly, while long-standing damage may take months to heal. It is also important to understand that low B1 affects far more than nerves alone. It can impact your energy levels, mood, memory, and balance. Many people feel constantly fatigued and assume it is simply due to aging, when in reality their body is lacking a nutrient it desperately needs. Here is exactly what you need to do, and the details truly matter. The first step is choosing the correct form of vitamin B1. Not all supplements are the same, and this distinction is critical. You should look for a form called benfotiamine. This version is absorbed and used by the body far more efficiently than standard thiamine. Regular thiamine often breaks down quickly in the digestive system, limiting how much reaches the nerves. Benfotiamine stays in the body longer and is specifically effective for nerve repair. When purchasing a supplement, carefully read the label and look for the word benfotiamine spelled clearly. If the label only lists thiamine without specifying the form, it can still help. But benfotiamine is generally more powerful for nerve health and worth the additional cost. The second step is taking the right dose. For nerve repair, a daily dose between 150 and 300 milligrams of benfotiamine is typically recommended. This range is considered therapeutic for healing damaged nerves. Vitamin B1 is water-soluble, meaning your body uses what it needs and safely eliminates the excess. There has never been a documented case of B1 overdose. If your symptoms are severe, starting at 300 milligrams is often appropriate. Milder symptoms may respond to 150 milligrams, but many older adults require the higher dose to see meaningful improvement. The third step is timing and consistency. Vitamin B1 should be taken every morning with breakfast. Because it supports energy production, taking it earlier in the day is best. Taken at night, it may interfere with sleep for some people. Always take it with food that contains a small amount of fat, such as eggs, nuts, or avocado, to enhance absorption. Never take it on an empty stomach. Place the supplement somewhere you will see it every morning, such as next to your coffee maker, and consider setting a daily reminder. Consistency is absolutely essential. Missing several days in a row can slow or even reverse progress. Once you begin taking B1 correctly, there is a general pattern of improvement many people experience. During the first week, increased energy and mental clarity often appear before changes in nerve symptoms. People frequently report feeling less foggy and more alert. By the second week, subtle nerve improvements may begin, such as reduced tingling upon waking or a slightly more natural feeling in the feet while walking. These early signs indicate that the nerves are beginning to respond and repair. By weeks 3 and 4, improvements often become more noticeable and consistent. Tingling quiets down, balance improves, and confidence in movement increases. Over the following months, many patients experience life-changing improvements, including the resolution of burning pain and a significant return of normal sensation. Let me return to the story of Margaret, the 67-year-old patient I mentioned earlier. She came to me deeply distressed. She could no longer feel her grandchildren's hands when they held hers. She dropped objects constantly and had cracked her phone multiple times. She felt unsteady when walking and had already suffered 2 falls in 6 months. For 40 years, Margaret had worked as a seamstress, creating intricate wedding dresses, yet she could no longer button her own blouse. Her blood work revealed a severe B1 deficiency. We started her on 300 milligrams of benfotiamine daily. Within 14 days, she noticed her hands felt more alive. By 6 weeks, she was buttoning her clothes independently again. Within 3 months, she returned to knitting and sewing. She later told me that the treatment had given her life back, but in truth, it was her own body healing once it finally had what it needed. Margaret suffered for 2 years before seeking help, and she did not need to. No one does. Before finishing, there are several critical warnings that must be addressed. First, proper testing is important. Ask your doctor for blood work that includes vitamin B1 levels so you can confirm a deficiency and monitor progress. Second, if you have kidney disease or take multiple medications, you should consult your doctor before starting supplements. Vitamin B1 is generally very safe, but individual circumstances matter. Third, medication interactions are real. If you are taking diabetes medications or diuretics, your doctor should be aware that you are supplementing so levels can be monitored appropriately. One final point that deserves attention is that vitamin B1 works best when combined with other B vitamins, particularly B6 and B12. These nutrients function as a team to support nerve health. Rather than taking B1 alone, many people benefit from a high-quality B-complex supplement that includes benfotiamine as the B1 source, along with adequate doses of B6 and B12. This combined approach can significantly enhance nerve repair and overall neurological function. Here is a simple action plan you can follow to support nerve repair over the next 4 weeks. And I encourage you to take it seriously because structure and follow-through make a real difference. During the first week, request blood work from your doctor that includes vitamin B1, B6, and B12 levels so you have a clear baseline. At the same time, begin taking 150 to 300 milligrams of benfotiamine daily. Do not wait for the test results to come back before starting, because every day counts when nerves are deprived of what they need. In the second week, add a high-quality B-complex supplement that contains benfotiamine as the B1 source, at least 100 milligrams of B6, and 1,000 micrograms of B12. Take this in the morning with breakfast, alongside your benfotiamine, and continue doing so consistently. From weeks 2 through 4, keep a simple daily journal of your symptoms. Each day, rate your tingling, numbness, burning, or weakness on a scale from 1 to 10. This small habit allows you to objectively track progress that you might otherwise overlook. By week 4, schedule a follow-up with your doctor to review your blood work and discuss how your symptoms have changed. There are also a few bonus habits that can further support your recovery. Always take vitamin B1 with food, never on an empty stomach. Avoid alcohol as much as possible because alcohol interferes with B vitamin absorption and directly damages nerves. Include foods naturally rich in B1 such as whole grains, beans, and lean pork, even though supplements remain essential. Stay well hydrated by drinking 6 to 8 glasses of water each day, as dehydration can worsen nerve symptoms. This overall protocol has helped hundreds of my patients regain sensation, confidence, and independence, and it has the potential to help you as well. I want you to understand something important on a deeper level. I know how painful it is to watch yourself or someone you love struggle with nerve damage. I have sat across from patients who felt frightened, frustrated, and hopeless because they believed their symptoms were irreversible. You do not have to accept tingling, numbness, or burning pain as an inevitable part of aging. Your body has an extraordinary ability to heal, even later in life, when it is given the proper tools. Vitamin B1 is one of those tools, and for many people, it is the missing piece that finally allows the nervous system to recover. If this information has been helpful to you, I encourage you to share it with someone you care about who is over 60 and dealing with similar symptoms. Knowledge like this can truly change lives. Stay engaged, stay informed, and remember that your health is one of your greatest assets. With the right understanding and the right actions, your best years do not have to be behind you. You can reclaim comfort, confidence, and independence one step at a time.